This is online training outreach ONTRO. We are using learning management system to expand the learning frontier and helping primary healthcare policymakers, managers, and care providers learn, perform, and report. Join us on ontro.ihstrategies.org. You are welcome to online primary healthcare lecture series. The title is Primary Healthcare Development in Nigeria, Historic Visions and Milestones, and this is session 2. My name is Dr. Mohammed Jibril Abdullah. I am the ONTRO coordinator. We will start by talking about the PHC paradigm. Please recall that part 1 of the session on PHC development in Nigeria, historic visions and milestones ended with the discussion on the basic health service scheme. The primary healthcare paradigm in Nigeria is the second historic vision and milestone. Though primary healthcare movement started in 1978, primary healthcare momentum did not gain much mileage in many African countries until 1985. At the WHO African Regional Committee meeting in Bamako, Mali in 1985, African health ministers reaffirmed their commitment to the Alma-Ata Declaration and adopted a resolution to strengthen health systems using primary healthcare approach. The resolution articulated what became known as the three-phase health development scenario. The TPHDS demands that 1. The community-based health and related activities must be supported and sustained by appropriate 2. Operational, technical, and strategic support at 3. The district, intermediate, and the central levels respectively. This forms the basis of the primary healthcare development framework. Riding on the outcome of the WHO African Regional Committee meeting in Bamako, Nigeria began the LGA focused acceleration of PHC development in 1986 with the 52 model local governments. Because Nigeria is a large country, it was observed that it was not possible to make a meaningful start at the same time in all the then 310 local government areas of the country. Therefore, 52 local governments were selected as the models. The belief was that at every succeeding year, more local governments would be added to the number of model local government areas. For the first time in the country, planning for health services implementation was undertaken using the bottom-up approach, and a well-articulated step-by-step process and organization structure was formulated for establishment of primary healthcare, such that by the end of 1990, all the local government areas had started implementation of PHC in Nigeria. The progress of the 90s has been sustained, and today, primary healthcare is working in all the 774 LGAs with varying operational challenges, which will be the subject of future lectures. Now, let's look at the national health policy. By the strength of its provision, which recognize primary healthcare as the cornerstone of the national health system, the national health policy is the third historic vision and milestone of the country towards a health system that is based on primary healthcare. The triple phase health development scenario recommended the 3-tier levels for healthcare delivery, with primary healthcare forming the primary level and central focus. This development clearly influenced the development of Nigeria's maiden national health policy in 1988. The policy identified PHC as the cornerstone of the national health system and recognized the local government as the operational level for primary healthcare implementation. Now let's look at the strategies for PHC implementation based on the provisions of the National Health Policy 1988. The 1988 National Policy identified 4 strategies: the promotion of community participation in the planning, management, monitoring, and the evaluation of the local health system, the strengthening of the managerial process for health development at all levels, that is, the village development committees and the World Development Committees, and at other higher levels. The strengthening of functional integration at all levels of the health system, mostly between the primary, secondary level, and then the secondary and tertiary level. The involvement of health-related sectors in the planning and management of primary health care. What are the policy matters? The maiden health policy has been revised twice, in 2004 and most recently in 2015. Let's note that Nigeria does not have an holistic national primary healthcare policy, and therefore PHC specific matters are not sufficiently addressed in the national health policy and related policies. Nigeria therefore needs an holistic national primary healthcare policy to address more PHC policy matters. The revised versions had both retained primary healthcare as the cornerstone of the national health system. However, that should be seen by all PHC enthusiasts as mere tokenism. In contrast, the current version is the least PHC friendly and do not have the spirit and the body of primary healthcare. One would need to see the policy of Kenya and Ethiopia to make informed judgment on this assertion. Now let's look at the devolution of primary healthcare. The devolution of PHC to local governments happened in 1990 and can be regarded as a fourth historic vision and milestone due to its impact on the PHC system. Prior to the promulgation of the national health policies, the states owned and operated all health facilities within the LGA. This was considered incompatible with the health policy which assigned responsibility for primary health care to LGA. Consequently, the federal government directed that all the states should hand over primary health care facilities and personnel to local government by 30th June 1990. The devolution was to be a gradual process, but some states simply dumped the responsibility for facility and staff on the LGAs without any comprehensive plan. Let us look at the work of WHO High-Level Committee in 1992. The establishment of National Primary Healthcare Agency can be regarded as a fifth historic vision and milestone of the country towards building a sustainable primary healthcare. The country's effort in the reorientation of Nigerian health system towards PHC, which began in 1986, made considerable gains and was widely acknowledged globally. Consequently, at the invitation of the Federal Ministry of Health, the WHO High-Level Review Team visited the country to analyze Nigerians' experience in accelerating primary healthcare at the LGA level and recommended a means for its continuous strengthening and presented insights and lessons for other developing countries. The review team made 34 recommendations, and one of which is the recommendation to establish a government agency to safeguard the PHC system, nurture its continued expansion at the LGA level, support its progress, and promote the quality of the PHC services provided to the people. This led to the establishment of the National Primary Healthcare Development Agency by Decree 29 of 1992. Since its creation in 1992, National Primary Healthcare Development Agency has been at the peak of PHC governance in Nigeria, playing leadership and stewardship roles. The agency is not an implementing organization but a technical agency providing policy direction, guidance, and technical support to the states and the local government areas. Now let's look at another issue, the operational reform towards the World Health System. The operational reform in primary healthcare implementation, which led to the adoption of the World Health System in 2000, was the sixth historic vision and milestone of the country towards building a sustainable primary healthcare. The LGA is the operational level for primary healthcare implementation, and it is at this level that all resources are pooled for primary healthcare implementation. Hitherto, the LGAs operated the district health units with the LGA, district and community and village structure, with the district having the challenge of neither clear boundary nor administrative structure. In 2000, PHCD, as part of PHC Revitalization effort, introduced the World Health System. It would be recalled that WHO had noted that community mobilization would be greatly assisted if the boundaries of the health districts were synchronized with the electoral walls which elects a councillor to the local government administration. Therefore, an LGA World Community Village structure was adopted. Like the basic health service scheme, the World Health System was designed to be a basic health unit in each ward. It consists of a model primary healthcare center as a hub of cluster of primary healthcare clinics and health posts, and building community health system around the facilities in the world. The federal government commenced the construction of model PHC centers in target was to serve as the apex of all PHC services in the world. The centers were to be managed by the communities and emphasize community-based services. Like the BHSS effort, the initiative is presently dogged by sustainability challenges, as the initiative has been hijacked by the politicians as constituency project, and the states and local government are not living up to their expectations. This is the end of session 2 of Primary Healthcare Admin in Nigeria, Historic Visions and Milestones. For unlimited learning opportunity and other lectures, visit ontro.ihstrategies.org.